Because we knew the technology is precision. Say, if someone is telling, I'm having a problem, I'm having a chest pain, ECG gives an interpretation. Echocardiogram gives an interpretation. Angiogram gives an interpretation. Even among the angiogram, a CT angiogram and a regular conventional angiogram done in the cath lab is different. For a same chest pain, you are doing 4 methodology of investigation. What people will prefer? They want to do an immediate angiogram. Why not an echo? Why not an electrocardiogram ECG? Because the things have been evolved. The precision is going faster and faster. The conventional cath lab angio is giving the deepest analysis for the reason for the chest pain. If it is a cardiac pain and there is a problem in the heart, this is the ultimate thing that is recommended. So there is a transition. So there is a variation. So when this advancement in technology, especially medical technology, is there, and that advanced medical technology is getting integrated in our traditional medicine, now we can understand how ALM is different. Because at ALM we are practicing this integrative medical approach. Integrative medical approach is nothing but allopathy and Ayurveda integrating. We are integrating. So in all our ALM facility, we have an in-house allopathy doctor who's supporting the Ayurveda doctor in arriving at the diagnosis very precisely and accurately. That is where making the difference and taking ALM in a different path.
குழந்தையின்மை, சர்க்கரை நோய், இரத்த அழுத்தம், உடல் பருமன், தோல் மூட்டு வியாதி, புற்றுநோய், இப்படி எந்த நோயா இருந்தாலும் சர்வதேச ஆராய்ச்சியில் அங்கீகரிக்கப்பட்ட ஃபங்க்ஷனல் மெடிசின் வழியில் எளிமையா சிகிச்சை வழங்கி குணப்படுத்தவும் முடியும், நோய் வராம தடுக்கவும் முடியும்.
ஆரோக்கியம் நல்வாழ்வுக்கு ALM ஆயுஷுக்கு வாருங்கள்.
நோயற்ற வாழ்வே குறைவற்ற செல்வம். அதுக்கு ALM ஆயுஷ் வாருங்கள்.